Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
poisoning by antimuscarinic agents. Antimuscarinic agents poisoning. So first we have it occurs due to the deliberate ingestion of atropine belladonna. If a child knowingly or unknowingly or if anyone knowingly or unknowingly, if he or she takes atropine belladonna, then he might suffer from antimuscarinic side effects. And also the drugs like phenothiazine, excess intake of phenothiazine, or tricyclic antidepressants like nortriptyline and amitriptyline also has anticholinergic effects. Then H1 receptor antagonists also have anticholinergic effects. Now, symptoms of anticholinergic poisoning or antimuscarinic agents is the child presents with dry mouth or difficulty in swallowing and also talking. The child will present with dry, flushed and hot skin with fever and difficulty in micturition and decreased bowel sounds also. Scarlet rash may appear. The patient might present with CNS symptoms like delirium, visual hallucinations. There will be excitement. Then we have psychotic behavior will be seen with ataxia. The patient will also present with hypotension with weak and steady pulse, weak and rapid pulse with cardiovascular collapse is seen with respiratory depression. So the treatment of choice for this atropine poisoning is actually the treatment of choice is we should give something which will block the atropine effect. So we should give the drug of choice is actually physostigmine. This physostigmine is given in the dosage of 1 to 3 milligrams subcutaneously or intravenously. It will antagonize the central and peripheral effects, and thus it is found to produce hypotension and arrhythmias in some cases, whereas neostigmine does not antagonize the central effects, and thus this neostigmine is contraindicated.
thank you and thank you for watching.